You have heard that bones can fracture or dislocate, but have you ever heard that your penis can fracture too? This is Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, triathlon, the Lupus Day.
Nigeria, convener, triathlon, the Lupus Day. This morning, we had an emergency, and when I came to review the patient, it was a urologic emergency. It has to do with the guy's genitals. From what I was seeing, the penis was swollen and more like purplish, and looks weak and bent. So I was now asking the guy what happened. The guy should be average age around 34 years, and he's a pharmacist, or more like he works in a pharmaceutical company. So he was not telling me that last night he went for a club, and at a point he got a bit tipsy and he was dancing. So as he was dancing with one particular girl who possibly either works in the club or still just came around like him. So then at a point, the girl now lay him down on the dancing floor, such that he was lying with his back against the floor. Then the girl now jumped up and sat on his penis, and his penis was quite erect. Maybe because he was tipsy now and he was in the club and he was already high. The girl jumped up, sat there. Now he felt this very sharp pain, but the girl didn't stop. He was trying to stop the girl, but even before he could stand up, the girl would still jump up again and sit down, that is, and land with her buttocks on his penis. He said that by the time the girl was doing the fourth time, the pain was so much that she now started screaming with a loud voice, and the girl now left him. That was what he was describing. So he said he now got up immediately and ran out of the club, and while people around were laughing at him. So this thing happened last night. So by this morning, he discovered that his penis was now distorted, swollen, so he decided to rush down to the hospital. That was the story. So when I examined, I discovered that the penis was having this egg form deformity. I was asking him, has he been able to urinate? He said he urinated and it was bloody, because I was expecting that. And I asked him whether the not typical normal 4 o'clock, 3 o'clock, 3 in the midnight, 4 a.m. erection, whether I had it. He said no, there's no erection. So I told him, okay, no problem. And I now told him, and I started management. Of course, I had to use an ice pack, press the area, and had to bring pediatrics bandage and bandage the area, give him pain reliever, and now told him that we're going to refer him to the urology clinic. So the urologist now reviewed the letter and had to take him over to theater to correct something. So I now want to tell you what really happened to this guy, because this thing has been, this is like the 3rd time I've had this kind of case. So even though it was not similar occurrence, one was via road traffic accident, the other one was via a fall. He was drunk and he fell. But this is the first time I'm having a direct trauma where a lady was jumping up and sitting on the guy in the club. So this is what we call penile fracture of the penis. And it's a bit difficult. It's a bit different from the typical bone fractures, you know. So this one normally occurs, is a urologic emergency, like I earlier said, and this one normally occurs when there is a direct trauma against an erect penis. When there is a direct trauma against an erect penis. And then when such happens, what will happen is the tunica abugine will break. Tunica abugine that covers the corpora cavernosa will break. When it now breaks, the corpora cavernosa will rupture. Of course, you know corpora cavernosa, that place that blood enters to cause erection. It will rupture. If it now ruptures, the penis will become flaccid, lose its erection. Now, in very severe cases, you know the urether is in between the corpora cavernosa. The urether can even be affected, and that is where you now start having difficulty in urinating and bloody urine. So it can still happen apart from somebody sitting on you, just like I said, road traffic accident. It can still happen when a girl is riding you, or maybe when you are having sex directly with a girl, with your spouse, and the penis comes out from the vagina and hits the perineum. These are the areas where this kind of thing can happen. So the advice I have for everybody, number one, is of course prevention. Do not allow anybody to jump and sit on you. Limit a girl riding you. And then whenever you are having fun with your partner, be careful not to be thrusting so hard so that it doesn't pull out to hit on the pubic bone. And then if it ever happens and you develop penile fracture, please rush to the emergency just like this my friend did. Thanks and God bless.
Penile fracture is treatable and absolutely avoidable. Dr. Okafor Chidumeje, CEO at OurDrKing Foundation Nigeria, convener, treatathon, the lupus